Hey everybody, it's Peter. I haven't done the shout outs in a while. It's October 22nd. We're getting close to Halloween. Maybe next week we can give you an update on how trick-or-treating might be working in the state of Pennsylvania. COVID census today on the positive side is 13 across the 3 hospital system. And here are the shout outs. So I'm going to move quickly. Mark Mungen in HR would like to recognize Richard Haas, who is a senior electrician who recently celebrated his 50th year of service with Crozier. Richard isn't alone with this achievement. Earlier this year, Nanette DeCroce in the lab also reached that same milestone, 50 years. It's amazing. Charlene Mahoney, who is the credentialing coordinator at CCMC, recently had a procedure performed by Dr. Ali Tahami with anesthesia provided by Dr. Ali Babiak, and she'd like to thank both of them for their skill and kindness with her surgery. It was kind of a complex surgery, and she was nervous about it, and they really did a nice job. She can't say enough things about both of them. This is a very condensed version of what the letter she wrote me. Google review on October 5th from a Taylor patient. You always get great reviews on Google, commending Tiffany in the ED for going above and beyond to make her and her husband extra comfortable during their recent visit. Next is a letter from Donna McGinnis, who used to work at Crozier for many of our former CEOs and COOs, about her experience at Springfield's cardiac rehab. She'd like to thank and recognize Brenda, Jerry, Connie, and Val for being so friendly and knowledgeable, and she wanted everybody to know that she's still on her exercise and diet program. Jenny Santiago, who is the administrator at Springfield and Britton Lake, would like to shout out to the endoscopy team for having stepped up to a challenge of getting back to 100 GI cases a week. Nice work out there, Britton Lake guys. This one's from Rich Hamilton, who is our emergency medicine medical director, who would like to recognize Stephanie O'Neill, who works in the lab, and due to a COVID-related call-out, ran the Taylor lab solo and did an unbelievable job while preparing multiple units of blood for an extremely ill patient. What a yeoman's effort there. I have a Facebook post that I'd like to share with you. It was shared with us from someone in the community who did not want to be recognized, but this is how it reads. It has to do with the Crozier drive-through test nurses. I had a drive-through COVID test this morning at Crozier to have an outpatient procedure on Thursday. I had a 10:30 appointment. When I got there at 10:25, I was the 12th car in line. It took me almost 40 minutes to get to the front of the line. The nurses were hustling. When it was my turn, I asked them, I ordered a cheesesteak and a pepperoni pizza with this. Is this the right place to pick it up? They laughed and said that we should consider adding food to their takeout duties. They were so pleasant and under stress and should be commended for risking their health like so many others in the healthcare field. So it's a really nice way to recognize the people who are out there no matter what the elements are. Thanks for working so hard. October is Breast Cancer Awareness Month, and we have a special guest. So stay tuned for an interview with Dr. Amy Voja, who is the Director of Women's Imaging at Crozier Health. Hey everyone, Peter here. It is Breast Cancer Awareness Month. It's the entire month of October, and we are very fortuitously joined today by Dr. Amy Voja. She's with Southeast Radiology. She's the director of our Women's Imaging Center, and she's fellowship trained and dedicated breast imager for us. Tell us about what it is to be a dedicated breast imager.
I have a specialty training just dedicated to breast imaging, and it means that I read a high volume of breast imaging studies, and with that get some more expertise in maybe picking up smaller breast cancers compared to someone who reads maybe a smaller volume or more casually.
Okay. So let's talk about the importance of mammograms on a regular basis. I understand there's an age that the government requires or suggests that we begin to perform mammograms. Let's talk a little bit about that.
Sure. The American College of Radiology and the Society of Breast Imaging recommends that patients undergo annual or yearly screening mammography beginning at age 40. And this has shown to decrease mortality rates in patients by nearly 40% since the 1990s.
Why is that? Tell the listening audience why it is that early detection is so important.
Sure. So with screening mammography, what is so important about screening mammography and why annual screening mammography saves lives is because we are actually able to see a breast cancer 2 years sooner on a mammographic image and compared to a patient being able to feel the area or even her physician being able to feel the area. And when a breast cancer is smaller in size, it's much more easily treated and the patient's surgery is often less extensive and her treatment options are often less expensive.
Early detection, no matter what the cancer is really important.
Mm-hmm.
It's probably more than half the battle. Life becomes so much simpler for the patient and the doctor because you caught it earlier.
Yes.
And that's what a mammogram can do. Much easier than somebody who might be looking to feel for a lump developing, because by the time you can feel it,
Mm-hmm.
it's pretty sizable.
Yeah,
right?
it can be pretty sizable, and yeah, and that I love that take home of that we can detect breast cancer 2 years sooner than it can be felt.
Right, that's a
So,
long time.
so just to also to go along with that, if patients, any of the watchers notice anything new in their breast, any changes, any lumps, any skin changes, any nipple discharge,
Mhm.
we would definitely want you to tell your doctor,
Mhm.
and then you could come in for something called a diagnostic mammogram and a possible ultrasound, which means we'll take a closer look at
Mhm.
your breast tissue, possibly with additional imaging,
Right.
mammographic imaging, and possibly an ultrasound.
Okay.
Oftentimes, the results could come back negative,
Mhm.
which is great. But if the area does need to be surgically removed,
Mhm.
we have an excellent multidisciplinary team
Mhm.
in place, and we actually discuss each patient's case at a breast conference
Mhm.
once a week.
Mhm.
So with our multidisciplinary group, we come up with the best treatment plan for
Right.
the patient.
Every situation is personalized,
Hmm.
right?
Yeah, very personalized
Talk
care.
about dense breasts. That may be something that the listening audience understands or may not, and I think it's interesting to know that with a dense breast, and I know you brought some images with you.
There's 4 different densities. A is a fatty breast, and we can see here this breast is mostly dark colored. Fat is dark colored on a mammogram. B is scattered fibroglandular tissue. C is heterogeneously dense tissue. And D is extremely dense tissue. See, for example, you can see here in D, nearly the entire breast is completely white or filled with fibroglandular tissue. So it can be more tricky to detect breast cancer in this breast because breast cancer also appears white on a mammogram. So just to illustrate that point, this image here is a fatty breast with a little tiny cancer that is very easily seen. And then here is an extremely dense breast. And we can see here that a much larger breast cancer is not very easily detected. And that breast cancer has that red circle around it.
Perfect.
And this is why dense breast tissue can make cancer detection a little bit more difficult to perceive.
So in these instances,
to see.
particularly with the image on the right, you're going to want a supplemental image
Exactly.
to be able to
Mhm.
pinpoint the problem.
Mm-hmm.
Right.
And that's where this risk assessment is so great that we're offering it, because this patient could likely, possibly, with this extremely dense breast tissue, undergo a yearly supplemental breast
Right.
MRI.
And with that sort of density on the image, you could be camouflaging
Mhm.
a development or a growth.
Correct.
Right. You're without insurance. There are 2 programs that we offer at Crozier. One's through the CDC in the state of Pennsylvania for either discounted or free mammograms, and the other one is a grant from our partners at the Delaware County Foundation. I'm going to leave you a telephone number. It's 610-447-2645, and you press option number 1 if you're interested in a mammogram and don't understand how it is that you might be able to afford it. We have a program available for you to do that. And this is Breast Cancer Awareness Month, and the 31st is National Screening Mammo Day. So for those of you who have loved ones who have not had their mammogram, please remind them that this is a great way to save a life and prolong a life.